Maintenant la séance. Bienvenue à la
I now call this meeting to order. Welcome to the 16th meeting of the House of Commons Standing Committee on Veterans Affairs.
to consider the Supplementary Estimate B2526. Today's meeting is taking place in a hybrid format pursuant to the standing orders. And before we continue, I would ask our in-person participant to consult the guidelines written on the cards on the table. These measures are in place to help prevent audio and feedback incidents and to protect the health and the safety of all participants, including the interpreters. Pour garantir le bon déroulement de la réunion,
To ensure that the meeting runs smoothly, I would like to give some instructions to witnesses and members. Before speaking, wait until I call on you. If you're participating by video conference, click on the microphone icon to activate your microphone. Please mute yourselves when you're not speaking. With regards to interpretation, those on Zoom can choose between French, English, or the floor at the bottom of their screen. For those in the room, you can use the headphones and select the desired channel. I would like to remind you that all comments from members and witnesses must be addressed to the chair.
First, allow me to welcome the Honorable Jill McKnight, Minister of Veterans Affairs, who is joining us for the first hour of this meeting. She is joined by the following officials: Christine McDowell, Acting Deputy Minister; Stephen Harris, Senior Assistant Deputy Minister, Service Delivery, and ADM Harris is by video conference. It's a pleasure to welcome you. Monsieur Pierre Tessier, Assistant Deputy Minister, Chief Financial Officer, and Corporate Services. And Mitch Freeman, Acting Assistant Deputy Minister, Strategic Policy, Planning, and Performance Branch. I want to say thank you for taking the time to appear today. So we will begin with the opening remarks. Minister McKnight, you will have the floor for 5 minutes. So whenever you are ready, Minister, and thank you very much for joining us today.
Merci, Madam Chair, members. I'm pleased to join you today to discuss Supplementary Estimates B for Veterans Affairs Canada. Since my last visit to the committee, I've had the privilege of participating in commemorative ceremonies and events across Canada before, during, and following Veterans Week and Remembrance Day. Each experience was a powerful testament to the strength and sacrifices of our veterans, broadening my perspectives and filling me with an even greater sense of respect and reverence. Canada owes a debt of gratitude to all those who have worn and wear the uniform. The Government of Canada remains steadfast in its responsibility to deliver the care, benefits, and recognition that our veterans and their families deserve. Through these supplementary estimates, you will see that expenditures for Veterans Affairs Canada will increase by 14.2 million over the forecasted amounts. I would also like to speak to items in Budget 2025 that directly relate to the Veterans Affairs Canada and veterans. Through this budget, we are delivering on our commitment to Canadians when they elected this government, spending less on government operations so we can invest more in Canadians, including our country's veterans. We are taking concrete steps to ensure veterans receive the compassionate, timely support they deserve. With Budget 2025, our new government is investing $184.9 million over 4 years, starting in 2026-27, and $40.1 million ongoing to stabilize the Disability Benefits Service Delivery System. This investment includes $24 million over 2 years to modernize IT infrastructure and operational processes to manage increasing demand. Budget 2025 reflects the government's firm conviction to providing veterans with responsive and accessible benefits in a timely manner, backed by permanent funding in the years ahead. Additionally, the budget aligns the reimbursement rate under the Cannabis for Medical Purposes program with current market prices. To be clear, we are protecting access to medically authorized cannabis for those who are qualified to claim it. The adjustment does not impact veterans' authorization for reimbursement, eligibility for the benefit, or the daily gram limit. On a cash basis, the adjustment will save $129 million annually. In line with public sector accounting practices, future savings must be recognized immediately with changes to the benefits that impact long-term liabilities owed by the federal government. As such, Budget 2025 accounts for $4.23 billion in savings, the long-term impact of the reimbursement rate change. With the adjustment to the reimbursement rate of the cannabis for medical purposes benefit from $8.50 per gram to $6 per gram, the actual impact to Veteran Affairs Canada's annual budget remains less than 2% on a cash basis. Veterans can and should be assured that no reductions to any other service, benefit, or program is included in these savings. I would also like to address the proposed amendments to the Pension Act, the Veterans Wellbeing Regulations, the Department of Veterans Affairs Act, and the Veterans Healthcare Regulations that are included in Bill C-15, the Budget Implementation Act. The amendments to the Pension Act will clarify that province does not include Yukon, the Northwest Territories, or Nunavut for an annual adjustment method for disability pensions and related benefits. The BIA is also updating the rules to make it clearer how annual adjustments are calculated for the former earnings loss benefit. Additionally, it clarifies how the maximum monthly charge for accommodation and meals is calculated in the long-term care program. Taken together, these updates make the calculation methods easier to understand and remove any confusion about how they should be interpreted. Overall, they will offer veterans more clarity and transparency. These updates do not change how benefits have been calculated in the past, nor will they have a retroactive approach on the reimbursements that have been paid. We are updating definitions in the legislation to reflect Veteran Affairs Canada's practices. Canadian Armed Forces members, CAF veterans, and their survivors will continue to receive the same benefits they are currently receiving. The same formulas will continue to be used when calculating these benefits. Under the Pension Act, CAF veteran pension increases will continue to be calculated as they have been, using the higher of the Consumer Price Index and the wage rate increase. This is exactly as it was prior to the introduction of the Budget Implementation Act. Finally, Madam Chair, I will add one last update. I am pleased to share with the committee that effective immediately, a diagnosis of Gulf War illness will be accepted as part of a disabilities benefits application. While Veterans Affairs Canada has always accepted claims for veterans for illnesses and conditions related to their service in the Gulf region, the recognition of Gulf War illness was only recently added to the International Classification of Diseases, which provides some guidance used to inform decision-making. Over the last months, I've had the honor of speaking with Harold Davis and Mike McGlennon, respectively President and Vice President of the Persian Gulf Veterans of Canada, as well as colleagues from the House and Senate. I would like to thank them all for their strong advocacy. I encourage any veteran who has a diagnosis of Gulf War illness or related conditions to reach out to Veterans Affairs Canada if they believe they have conditions that were not previously recognized. Colleagues, thank you, and I'm happy to take your questions. Merci.
Thank you very much, Minister. I have to say the last part of your announcement is, I think, for many of us who had the pleasure of listening to some of those veterans, a very good news, if I may say. So just before we start the round of questioning, I just want to make sure that all questions are addressed to the chair. I always say that Christmas and the holiday season is on its way, so let's make sure that we have a very good meeting today, if I may ask. On this, I will invite Mr. Richards for the first 6 minutes.
Through the chair, Minister, how many times did you and the Prime Minister meet to discuss the portions of the budget related to Veterans Affairs prior to its introduction?
The budget process was a comprehensive process that had a lot of engagement with many individuals providing input on the needs of Veterans Affairs Canada and how we could best support veterans.
So how many times did you and the Prime Minister meet to discuss the Veterans Affairs portions prior to its introduction?
Again, there was numerous meetings to discuss the needs of the portfolio and how we best address that. And as we've seen,
numerous meetings between yourself and the Prime Minister?
There was numerous meetings to discuss the needs of the portfolio.
So in those meetings, was it you who advised the Prime Minister to make such deep cuts to Veterans Affairs?
I disagree with your comment about cuts. This is actually an investment in Veterans Affairs of $184.9 million, with ongoing funding of $40.1 million to follow.
Well, it's I will tell you that veterans across this country are concerned because they're hearing about the cuts. And what they're worried about is the fact that your government hasn't been transparent about what those cuts will be, and that leaves them concerned for their services and benefits. Could you maybe perhaps give some transparency and accountability to veterans right now and tell them what those cuts will be?
There will be no cuts to benefits or services for veterans. There is an adjustment that is being made to the rate of reimbursement for medical cannabis from $8.50 to $6 per gram.
Okay.
There is no cuts to benefits and services.
So you actually are asking veterans to believe that cutting the rate of reimbursement on a $245 million a year program is going to amount to $4 billion over 4 years. I don't think any veteran will believe that, but I don't think we're going to get a different response from you on that. So what I'll do is move. I've got another thing I wanted to ask you about. We've heard a number of different areas of concern where there has been some indication of what your government's going to do, and I wanted to touch on a couple of them and ask you about that. So the first one is with vulnerable veterans in long-term care. Due to a mistake, I think an honest one, made by your department, those vulnerable veterans were overcharged for their long-term care. And the response by your government was to sneakily put into like page 375 of the BIA a retroactive change to legislation that would ensure that those veterans continue to get shortchanged. On the other hand, we have disabled veterans who, again, due to a mistake by your government, were overpaid on IRB. And now they're getting bills for tens of thousands of dollars in many cases, going back 6, 8 years, and being expected to repay those immediately. These are veterans that are vulnerable, they're on a fixed income, maybe dealing with mental health injuries. Perhaps, this might drive them right over the edge. And the commonality in both these cases is veterans are the ones who are getting screwed. That's the commonality in those cases. So I guess I have to ask, why is it your government's reflex always to make veterans pay for your mistakes?
Through the chair, as I articulated in my opening comments, and I have said, there is no cuts or changes to the benefits that veterans, or benefits and services that veterans receive.
So are you telling me that these bills that veterans are receiving for tens of thousands of dollars are going to be wiped out then?
Through the chair, if a circumstance has changed in a veteran's life, such as a change in their income levels from a variety of sources, then there may be times where an adjustment is made. And as such, there may be communication with a veteran, and I encourage any veteran who has a question about the services and the benefits that they're receiving, the financial elements of it, to reach out to Veterans Affairs to speak to their specific individual case.
Well, I will certainly encourage veterans to do that, but I can tell you this is a problem that is affecting many veterans. We've heard often in this committee about sanctuary trauma, and this is another example of that sanctuary trauma. Your government is imposing these kinds of things on veterans, and it is having massive impacts on their mental health. And I certainly hope that it won't lead to another veteran suicide, because that is the kind of concerns that I'm hearing out there. Let me turn to something else. In regards to your plans to move to utilization of AI in processing claims of veterans. The government's own algorithmic impact assessment says that the new AI system will apply consistency, compliance, and financial efficiency filters. That means that's coming before human review. We already hear from many veterans who say that there isn't enough humanization in Veterans Affairs. So can you explain in plain language to this committee and to veterans how what you're looking to do differs from the idea of an automated denial of benefits?
Through the chair, the use and the implementation of AI as a tool can help with administrative roles.
Sorry to interrupt. There's not much time left.
Mr. Richards, do you want an answer?
I don't have enough time to listen to something that's not going to really respond.
Actually, you do not have any more time, Mr. Richards.
You've just interrupted me, Chair. I do have time.
You have over 6 seconds already on the clock additional.
I do have time.
Mr. Richards, your time is up. Thank you very much. I will now pass for 6 minutes, Mrs. Hurdle.
Thank you, Chair. Good afternoon, Minister. Thank you for being here today. There's been some misunderstanding and perhaps some miscommunication or mischaracterization of what Budget 25 does and doesn't include. So let's just put it on the record here right now. Does the $4.23 billion figure outlined in Budget 2025 represent a cut to services or benefits for veterans?
No, it does not.
Lovely. Are you cutting the cannabis for medical purposes benefit for veterans?
We are making an adjustment to the rate of reimbursement on a per-gram basis from $8.50 to $6 per gram for the cannabis for medical purposes.
Thank you. And I'll wait and ask the other members here about the accounting aspect of that later. Parliamentary Secretary Casey and I recently met with some Gulf War veterans, and I'm very interested to hear more. Would you expand on the new medical recognition?
Thank you very much. As I said, I am pleased to be able to announce this change in recognition as a service-related condition to better align with other nations and the international classification of diseases who recognize Gulf War illness. While illness and injuries related to the Gulf War have been recognized for several years, this formal recognition validates the lived experiences of the Gulf veterans and highlights the importance of continuing to provide clear and accessible pathways to benefits. Again, I thank the members of the Persian Gulf veterans for their advocacy on this issue and the continued opportunity to engage with them.
Absolutely. Thank you. So Budget 2025 does outline $184.9 million, a 4-year commitment, and a further investment of that $40.1 million ongoing to modernize delivery at Veterans Affairs. What do these investments mean for the staff at Veterans Affairs Canada who are working currently on the front line of service delivery?
Thank you. Through the chair, this investment means that we are going to be able to invest part of it in the modernization and tools to support the incredible individuals who are delivering the frontline services to our veterans, thereby allowing them the capacity to continue engaging with the increasing number of clients that are coming forward. And most importantly, the $40.1 million ongoing is a long-term investment that will allow us to continue to deliver the highest level of service to our veterans and to respond to their needs with long-term certainty.
Okay, thank you. I will dip a little bit into the accounting aspect then, as we're well ahead of our time. To the best of your knowledge, are the accounting rules used to track and outline the accrued savings unusual in any way?
No, through the chair, no, these are not unusual rules or accounting methods. They are methods that are used consistently throughout public service, of recognizing the full value of the long-term liability at the start end, and then the impact that has in the long term. You mentioned that you will perhaps be asking questions of the officials that may be able to expand further on that part of it, but I have the utmost confidence that this is a standard practice across the public service and in line with a standard accounting practice.
So to the best of your knowledge, is this a new accounting practice?
Through the chair, to my knowledge, no, this is not a new accounting practice. This is a practice that is standard procedure in the public service.
Okay, do I have another 30 seconds? Okay, wonderful. Not a new accounting practice. It's not unique to this department. It is across the federal public service and through the federal government. Do you know if this accounting practice is exclusive to Canada?
Through the chair, I do not know specifically. I would defer to the Chief Financial Officer to speak to the specifics of that, as that is their expertise.
Wonderful. Okay, thank you. We'll have more of those questions. Yeah, no, yes? If there, you got 20 seconds, maybe?
20 seconds.
There you go.
Through the chair, the accounting practices are common in North America and throughout. Yeah, there's no differences. They're very common.
Thank you very much. Minister, this is not your first time at this committee. As you know, Madame Gaudreau will be asking questions in French. So we are always a little bit, we know that through the interpretation, sometimes it takes a little bit of extra seconds. So please, Madame Gaudreau.
Merci. Thank you, Madam Chair. And thank you, Madam Minister, for being here. It's so important to be able to follow up. I have a few questions, but I'm wondering, have you had the time with your busy schedule to listen to the last meetings that we've held here in committee?
Merci pour la question.
Thank you for the question.
In English? Thank you. I am receiving regular updates from the ACVA committee members, from department officials, and from my team that attend the meetings, of what has been transpiring in the meetings, what is being discussed, and the information that is being presented. Thank you.
Given that there are many people listening, I'm thinking of our veterans. We had a good news story with regards to cannabis and also with regards to Gulf War illness. So I would like to ask you, are there some files that are in process now and will be disclosed? Is there something that we might be able to announce to our veterans that are listening today? Something in the pipeline.
The announcements that I have today is the recognition of the Persian Gulf illness, and the investment and the ongoing investment in both the stabilization and modernization of the service delivery. And those are good news stories, as this is allowing us to ensure that veterans are receiving the care they need and they deserve in a timely and accessible fashion.
Est-ce qu'on peut espérer, parce que
Well, it has been mentioned several times to consider the state of health of our veterans, and they've told us that they feel abandoned. And also, many have told us that in the past there were veterans hospitals and we had access. They say that they have very specific situations, sometimes very heavy and difficult situations, and it's very hard for them to have access to a hospital, to have access to care. Could we hope that there might be a reopening of veterans hospitals?
I recognize and appreciate the frustration that exists when veterans cannot access the care they need, perhaps because they don't have a family doctor or for a number of other things. And I acknowledge that veterans have unique experiences that are unique to their circumstances. And so having an individual who's familiar with that can provide special or specific insight into the needs of the veterans. We are going to continue to ensure that veterans have access to the care, the best possible care that they can. And as you know, healthcare is a provincial responsibility, so that engages working with the provinces and territories to ensure that veterans have access to that care.
parce qu'on a reconnu
We have recognized that there's compassion fatigue when you have many cases that are added on. Oftentimes there's a lack of human resources, and also there's a lack of specific experience. So also a thing that has been noted is that there was a lot of private subcontractors that were being used. And if I talk about Lafmar and Loblaws, the witnesses said that, in fact, they were not specialized in veterans care. So could we hope to have a specific program or at least an announcement for the thousands of organizations that exist? And they need a doctor that's specialized within their organization, perhaps to see an increase in funding. And I could give you a list. We have about 50 that say, well, maybe we can try, but we really need help from the department. So what do you have to say to them?
So again, ensuring that veterans have access to care to meet their needs is the top priority. You made reference to some of the service providers that are out there. That the connection for veterans there is making service available on a much broader scale. It's connecting veterans with 12,000 health professionals across the country to be able to access the health care to make it available to them. There is ongoing training, engagement, continuation of improvement, which happens in all cases.
J'ai mon chrono, tout va bien.
Félicité d'être aussi.
Okay, great. You've been really perfect with your time. It's impressive, I have to say.
For 5 minutes.
Sure, thanks. Let's pick up where we left off before we were cut off. That same algorithmic impact assessment that I referred to earlier states that, and I quote, veteran input data errors may negatively affect outcomes. So what I'm wondering is, why is that sort of a burden being placed on disabled veterans to provide absolutely perfectly formatted medical and administrative data Because clearly that's just going to mean more delays and denials for veterans.
I believe you're circling back to the use of technology and AI to supplement. May I just clarify that? Okay, thank you. With the engagement of these tools, we are assisting with some of the administrative aspects of it so that the frontline individuals who work with veterans have expanded capacity to engage with veterans.
Okay. I'll let you do it. We were battling over the microphone there. But when it says veteran input data errors may negatively affect outcomes, when I hear negatively affect outcomes, that means to me, you if you think otherwise, I'd love to hear. But doesn't that just mean more delays and denials for veterans? Like if that form isn't perfectly filled out and the AI doesn't get it, this is already a challenge for veterans that find that they're delayed, and there's always a return of a medical form because a doctor didn't quite fill it out right. Like this is already a problem, and what it's saying is that this could get worse with the use of AI. So what do we say to what do you say to veterans? Like this, they fear this is going to mean more delays and denials, and they're probably right.
Through the chair, my engagement with veterans is around how do we support you to equip you for this process to reduce barriers, which I believe goes back to part of what you've referenced, but then also how do we look at our processes on the other side to ensure that we are using our resources in the maximum way capacity to be available to work directly with veterans. I believe it's a multifaceted approach of working to improve the system overall.
All right. I don't know that that's going to give veterans any more confidence that they're not going to face worse delays and denials, but I guess we'll have to agree to disagree on that one. I'm going to turn the rest of my time to Mrs. Wagenthal.
Okay, thank you, Chair. We have had testimony recently on suicide with veterans, and through the current study on preventing veteran suicide, we learned that our province of Saskatchewan Legion Command is funding veterans' costs for a successful cutting-edge new treatment regime for PTSD and being very successful, called SEPTR. VAC has refused to fund it. So I'm just wondering, can you tell me, we need to provide what veterans feel works. Are you prepared to listen to veterans on programs that they want to be seen as included in veterans' supports, as options with those providers that are within the Partners in Canadian Veterans Rehabilitation Services? Are you open to hearing and suggesting moving forward with ones that they feel are very effective?
So, through the chair, engagement with veterans is a huge part of what goes on, and meeting their needs for care, and specifically to PTSD, is the first priority.
Can I ask further then? Have any of them suggested programs to you that are not included as options for them in PCVRS?
So the department is continually reviewing new and emerging treatments and the science that goes with them.
Can I ask where that list of treatments is? Is it possible for veterans to see all of those options? Would we as a committee be able to see which providers PCVRS is using at this time?
I don't have that information with me right now, but I would be happy to follow up with you.
And provide it to the committee?
I will certainly come back with an update.
A list. A list.
I will come back with an update of the information that is available.
Reminded by my greffier. So on this, I would now like to pass the floor to MP Casey for 5 minutes.
Thank you, Madam Chair. Welcome, Madam Minister. In his first round of questions, Mr. Richards alleged that veterans have overpaid and are now receiving bills for tens of thousands of dollars for repayment of their IRB. Is there anything that was introduced in the budget that would warrant a repayment demand on the part of the department to veterans for IRB?
Through the chair, no, there was nothing that would demand a repayment in the budget.
Okay, Minister, you were invited here to talk about the estimates, so why don't we do that for a couple of minutes? In the supplementary B estimates, there's $10.5 million to the Federal Health Claims Processing Services contract to ensure continued delivery of health care authorization. Can you tell us a bit about that?
Thank you. It is, we are ensuring that we have, are able to deliver the care and services or supports and services that every veteran who comes forward with a request is requiring, and this is ensuring that we have the available funds to meet those needs.
And as is often the case with Veterans Affairs, these increases requested through the supplementary estimates are the result of the benefits being statutory and as a right. So anyone who applies cannot be told we're out of money. There's an obligation to pay, and so we have to accurately estimate how much to pay, and sometimes that requires adjustment. Is that a fair summary of why we are where we are?
Yes, it is. That is a fair summary of that. As you mentioned, a veteran that comes forward will receive the care, whether they come forward today, whether they come forward 10 years from now. A veteran that comes forward with a need, we will be here to meet their needs to deliver the benefits and services. And as you said, the estimates are a best guess based on how many individuals are going to come forward, and so it is necessary to make adjustments to make sure that we are responding to the needs of the veterans who are coming forward.
Okay. Thank you, Minister. The other two specific items in the estimates speak to advertising initiatives to make families and their caregivers aware, and also money specifically targeted towards peer support for sexual misconduct or military sexual trauma. Can you speak to those two things that appear in the sub-Bs?
Yes, thank you for the question through the chair. So you mentioned the money for advertising. That is to engage with veterans and their family members on the benefits and services that are available to them. In referring back to the conversation we just had, we want to ensure that veterans who have a need for benefits or supports are accessing them and are coming forward to receive them. So this is initiatives that will be communicating with veterans to ensure they are aware of what's available and how they can come forward to receive that. The second that you referenced was the funding for the peer support, specifically for the sexual misconduct and military sexual trauma that is undertaken in partnership with the Department of National Defense as we support individuals who have had experiences with military sexual trauma and ensuring that the peer support program is there to provide services for those individuals.
One other thing that I wanted to clarify from the first round of questions, and that was the allegation that the veterans continue to overpay for long-term costs. It's my understanding that that allegation is currently being attested in court. Has the court resolved that question yet?
I do not believe so.
I believe you are right. That the very question that is asserted as a fact is still being litigated.
Correct.
Thank you.
5 minutes.
Merci beaucoup, Madame la Présidente.
Thank you, Madam Chair. What I found very striking in the testimony is that a lot of people told us that they have lost trust in the promise of Canada. You must have been quite disappointed when you hear that from veterans.
Sorry, I just needed to turn the volume up a bit. Canada is here to support our veterans. Our veterans have given an incredible amount for our country, and we are here to support them. And if there is a disconnect between that, then there is an opportunity for us to continue the relationship, to show that support to them.
Tellement ça demander au Père Noël qui nous.
Well, it would be nice to ask Santa Claus to have a magic wand to turn things around, because most of the witnesses, Madam Chair, were saying it's not enough. It's like a contract type of contractual decisions, and we need a department that has a humane touch, a more human department, and that's what I wish for them. And I would really like that we could have something more concrete. You know, there's 10 ministers in 10 years. I know that we can't do miracles, but I'm thinking of the veterans right now. And I'd like to know what your priorities are. We know that we can't change everything from one day to the next, but to say there'll be services, things are going to go well, they don't have any confidence. And it's not just no confidence in you, it's the system. So what would you have to respond to them with regards to concrete objectives in the shorter term?
So first, I would like to acknowledge the incredible individuals that are the frontline workers that work with our veterans. These are individuals that show up with compassion and care and just the most warmth on a continuing basis. And working with some individuals, as you've mentioned, that have faced some traumatic things, such as individuals around them who may have gone through suicide.
Madame Gaudreau I have to say. Merci beaucoup, Madame Gaudreau. Madame la Ministre, merci. Now have, I do believe, MP Tolmie for 5 minutes.
Well, thank you, Madam Chair, and thank you, Minister and witnesses, for joining us. Through you, Madam Chair, we recently had a witness complain that every time he calls Veterans Affairs concerning his file, he gets a different caseworker, and therefore he has to start his process from the start every time he calls. I've been on this committee for 4 years since I was elected in 2021, and you are the 5th Minister of Veterans Affairs in the 4 years that I have been here, and the 9th Minister of Veterans Affairs since the Liberals were voted in 2015. What message does this send to the veterans who have had 9 ministers in 10 years and 5 in the last 4 years? What kind of care are you giving veterans? What kind of attention, what kind of priority are you making veterans?
Through the chair, ensuring that veterans have access to timely and compassionate care is what I am focused on every day right now. You mentioned that there has been a turnover of ministers, and that is accurate. What has been consistent, though, are the individuals that I referenced in my remarks just a moment ago with regards to the compassionate and incredible individuals that are engaging on a day-to-day basis with the Veterans Affairs staff, the team with Veterans Affairs, the case managers who are working with the veterans one-on-one on a daily basis. And that is the key, and that's part of why we're making the investments with the budget to be able to continue that care for veterans.
Madam Chair, I, with all due respect, this feels like a I Love Lucy rerun because I've heard this by every other minister that sat in here. So what do you expect to accomplish in the time that you are here? You've talked about timely and compassionate care. That's the same thing I heard from the last minister and the minister before, and we've not seen a change. We've not seen compassionate care. What we've seen are witnesses come forward complaining that they're not getting compassionate care. How do you expect to change this after 9 years? After 10 years, pardon me.
So the experiences that I've had in my travels differ from yours. I have had numerous veterans speak to me about the engagements that they've had with Veterans Affairs and with the individuals that are working directly with them in the positive experiences. You asked about how we will continue to improve upon that. That's part of why we're investing in the modernization so that we can.
Madam Chair, I appreciate that answer, Minister, but with all due respect, if you're just getting the fluff from people that are saying everything's good and you're not listening to what's going on here in this committee and what's bad, you're never going to fix the problems that the veterans are dealing with. What are you going to do to fix the problems that the veterans who have been coming here are dealing with? Are you talking to them?
Through you, Chair, I am talking to veterans with a variety of experiences. I am talking to those that have had positive experiences, and I'm talking to those that have faced some challenging circumstances. I am speaking with individuals on our advisory committees that come with their lived experiences and the experiences of those around them. I am going out and visiting locations where veterans are coming together to give feedback. I had a recent opportunity in Calgary to meet with a number of veterans when I made a visit there, and there was both positives and opportunities for improvement.
Thank you. Through you, Madam Chair. I mean, we've had a witness that couldn't even get a ramp for a wheelchair, and she's asked for people to go and visit. I'm very happy to get her address and send you there so that you can tell her the experience, or she can share the experience that she's had. The experiences that veterans are having are not good, and we need to see a change. What kind of change are you going to bring to this table here?
So change will come with having the investment to be able to invest in veterans and to have sustainable long-term investment that is ongoing so that we can continue the progress that we are making.
Perfect. Merci beaucoup. Thank you, Minister. And now we will go to Mr. Clark for 5 minutes.
Thank you very much, Madam Chair. Thank you, Minister, and officials for being here today. Minister, I know that you've been staying fully abreast of what's been going on in this committee, within the department. I know when you were in my riding the day before Remembrance Day, we had a meeting with the organization that, as you say, had lots of good things to say, but some things that needed to be improved as well. And when you're dealing with an organization as complex and big as Veterans Affairs, that's to be expected. I think that's mature and responsible. I think that's what Canadians would expect from all of us. So I just wanted to ask, we've heard about service delivery and the need for veterans to get the best possible care, which I know you agree with. That's something that's come up during the study that we're doing right now on suicide prevention. And this is reflected, I think, directly in the budget with a $185 million investment over 4 years for service delivery. So perhaps I just give you an opportunity to speak about how you think that will improve the service delivery model for veterans across this country.
Certainly. Thank you, through the chair. The opportunity to engage both in the experiences that veterans have with the individual frontline staff is very core, and making capacity available to engage with more veterans, as I said, through the use of modernizing technology and more specific incorporation of technology to support those activities. In terms of getting into the actual specifics of how that would roll out, I would turn to the department officials who will be the ones implementing those specific steps to speak to what that looks like.
And I will certainly ask about that in the second hour as well. So thank you, Minister. I also wanted to make sure we had a chance to clarify some of the discussion around the $4.2 billion in the budget. You mentioned in your opening remarks, I believe, that you see that as savings over time as opposed to cuts. And I think that's a meaningful distinction. It's an important distinction. We've heard this referenced on the floor of the House today and in social media, and we need to be as accurate as possible for veterans, I think, is really key. So could you explain for me, Minister, and for the committee and for veterans, how you see that figure, and when you say you see it as savings, what exactly do you mean by that?
So thank you for the question and the opportunity to provide more clarity around that. This is an adjustment to the rate of reimbursement for medical cannabis to be in line with market rates. As I said, we are not changing who qualifies for it. We're not changing how much they receive. We're not changing any of those elements of this. This isn't about an adjustment that then has long-term implications when we look at the accrual process, which we'll get, I'm sure others will get into the more specifics of that. So in making this adjustment, the impact is significant, which allows us to ensure that we are not cutting any benefits for veterans. They will continue to receive the benefits and services that they have been receiving, and to ensure that we are able to meet the needs of all veterans who come forward.
And so to characterize that as a cut in core programs or services for veterans would be inaccurate in your view, is that right?
Correct. That would, to characterize it as a cut would be inaccurate.
And I think I have about a minute left, Minister, and you only have a few minutes, so I just wanted to give you a chance in this last minute here if you wanted to clarify or touch on or highlight anything that either you wanted to correct or amplify that's come up over the last hour. Thank you.
Certainly, and thank you very much for that. One of the items that I didn't have a chance to speak to that I'd like to is the acknowledgement with, we mentioned about the acknowledgement of Persian Gulf illness. One of the other elements that the Persian Gulf Veterans has also been working with Veteran Affairs on is the commemoration of the 35th anniversary of the Persian Gulf that will be taking place in the new year. And so again, that speaks to the acknowledgement of modern day veterans, and that the department is working closely with those veterans on that for the new year on the 35th anniversary.
Thank you.
Well, on this, good news, I must say. Thank you very much for providing us with this update. Certainly from the Persian Gulf veterans, I think they will be very happy to, and we should amplify your news today. Minister, I want to say thank you on behalf of our committee for joining us. And certainly I will say on our behalf, Merry Christmas, Happy New Year. We wish you the very best, and I have a sentiment that we'll see you sometime next year, Minister. But on this note, I will suspend, but thank you very, very much for coming today.
like to ask people to take their seats to start the second hour of our meeting. Representatives from the Department of Veterans Affairs will be with us for the remainder of the meeting.
Second round of question, I will remind members that we do have two items in the supplementary estimate B that this committee may wish to vote on. So about 10 minutes before the end of this meeting, I will dismiss our witnesses so that we can proceed to the votes. We will now start our second hour of questions and answers with the witnesses from the Department of Veterans Affairs. Bienvenue. Je vous laisse. On ne fait pas de ronde de questions, donc on va passer directement aux questions, chers.
So we'll go directly to questions of the witnesses.
Mr. Vierson.
Madam Chair, and I want to thank the witnesses for being here. Just carry on with my colleagues' comments around veterans in long-term care. Folks have come and approached me saying that there's over 100 cases of this where a veteran is moved from one long-term care facility to another, and that is splitting up a marriage, or a spouse is being left behind in another care facility. I just wonder, are you aware of this?
Thank you so much for the question, Madame la Présidente. Certainly we know families are very important to the care of our veterans, and ensuring that those families have the supports that they require in order to support the veterans is critical, particularly as veterans age into long-term care. For specifics on the cases, perhaps I'll turn to Senior ADM Stephen Harris, who joins us.
Thanks so much for the question. And I'd answer it by saying this. Admissions to long-term care facilities are done based on provincial decision-making. We define eligibility for veterans who are eligible for long-term care, and we often work with local facilities to make sure that families can be kept together in institutions where that's possible. As you might expect, Madam Chair, the challenges, sometimes they have different needs, different levels of care needs, and other things that may be difficult. Long-term care is a very challenging space across the country. There may be gaps in availability in terms of beds accessible and others, but we work with families quite deliberately to make sure that if families, a husband and wife or partners want to remain together, that we're able to try and work with facilities to help support them.
Is there a particular contact person or area that we should be pursuing with these cases?
Thanks again for the question. Any case where there may be a challenge, I would suggest that members raise that directly with the Minister's office. The Minister's office will work with the department, and the department will be happy to work with long-term care facilities, families who are expressing this concern.
All right. Turning to the headlines that have been created around Veterans Affairs Ministry, in the budget 2025, it's been reported that $4.2 billion in cuts will be coming to Veterans Affairs. Now, we've heard previously from witnesses that 95% of the budget goes to veteran services or payments. Can you explain to us how this is going to work, where those savings are going to come from?
Madame la Présidente.
Thank you for the question.
Heard the reimbursement rates for cannabis for medical purposes in her remarks, and that the overall accrual cost represents savings rather than cuts to any programs that veterans are accessing. Perhaps I'll turn to Pierre Tessier, CFO, to respond to the question in more detail.
Perfect. Thank you, Madam Chair. Just to elaborate on the actual 4.2. And really the most appropriate reflection of the impact in the budget. There were two numbers in the budget. There was a 4.2 and 129 million ongoing. The 129 million ongoing is less than a 2% reduction in the budget overall. And the way to characterize, and the way that I see it, because accrual accounting is not simple as we look at it, is that you characterize the 129 million over a 30-year period, gets you to approximately $4 billion, and that, when there's a change to the program, the change has to be reflected in a 4-year period, which you see in budget currently. These calculations and the calculations of accrual accounting are done through the Office of the Chief Actuary, which is an independent organization of the organization responsible for completing all analysis for Government of Canada on all these type of pension programs.
So you're saying a $250 million program that will have a slight reduction over the next 4 years, you're going to count that as a $4.2 billion. That doesn't make any, like, I guess over 30 years, 129 million per year makes it 4.2. But how come it's being reported then in the 2025 budget?
Correct. Thank you for the question, Madam Chair. Just to clarify, continue to clarify, the way that if there's a change to the program once the budget is passed, we have to reflect those numbers in a 4 to 5 year period because those costs are no longer amortized over a 30-year duration.
It sounds like to me like the government wants the headline to be like we've being fiscally responsible, but we're not actually doing anything. Like it doesn't feel like there's actually much taking place on this. It's not real.
Well, the reduction in program is the ongoing cost of 129 million.
129 million. All right. Well, I'm glad we've cleared that up. Thank you.
Thank you, Mr. Viersen. I will now pass the floor à Madame Auguste pour 6 minutes.
Merci beaucoup, Madame la Présidente.
Thank you, Madam Chair, and thank you for being here today. As my colleague mentioned earlier, that 94% of the Veterans Affairs Canada budget goes to veterans. So how will this new budget affect your operations? When we look at 94% of the budget, it will still be going to the veterans? Has that changed?
Thank you so much for the question, Madam Chair. In fact, Budget 2025, as we've talked about, actually is an investment in the care that we are providing veterans, $184.9 billion to allow us to continue the care that we are providing and stabilize those resources to the benefit of veterans. And additionally, $40.1 million to allow us to carry out modernization to our service delivery model to better allow us to serve those veterans that are coming in increasing numbers as we look at our caseloads, allow us to make sure that we have services offered to benefits offered to veterans in a timely, in a convenient, and an accessible manner. And that, again, I would remind folks that 94% of our budget of our operations actually goes directly to veterans. Thank you.
Thank you. So you're clarifying that 94% of this budget will also go to veterans care.
Merci beaucoup.
Thank you. Now, well, last week, we heard testimony from Francophone veterans, and they were talking about French language services. I'd like to know what's happening with French language services right now at Veterans Affairs Canada. What percentage of people are speaking French, and are the Francophone veterans able to obtain services quickly?
Merci pour la question.
Excellent. Thank you for the question, Madam Chair. Accessibility and inclusivity of both official languages is something that's very important for us at Veterans Affairs Canada.
Take it. Direct and intentional efforts to make sure that we have a balance of outcomes for both Anglophone and Francophone clients and veterans. In terms of our overall performance, perhaps, Stephen, I will turn to you to provide some more detail there, but certainly have been very pleased with the efforts and the results.
Merci beaucoup.
Thank you. I can share that regardless of where veterans live, they're able to access French language services. We have service providers that can provide French language services. There are service contracts. We have our call center as well, and they're able to respond to Francophone calls and also online, in person. So we have different types of programs that exist. We have French language providers. We have French language employees. We have nurses and others who make decisions on requests and submissions made by veterans. Once again, if the application or the request is sent in English or in French, regardless, the application is dealt with. We do have human resources in order to respond throughout the country. And also, with the service contracts that we have, either to help people to find a job or to obtain medical treatment, we have the ability to help veterans, Francophone veterans. Perfect, thank you. Earlier on, with Madam Minister, you spoke about AI use at Veterans Affairs Canada. Could you clarify for us, how are you going to use AI? Thank you. Thank you for the question, Madam Chair. AI is a tool. It's a tool that we can use to help our employees with regards to administrative tasks.
Be used to support our staff with administrative tasks. As the Minister mentioned, it actually frees up capacity for us to be able to work directly with our clients and our veterans, providing that more human touch. We are publishing on the AI registry all those instances where we are using AI in the department to ensure that Canadians know how AI is being used. And it is very much in support of activities. We want to assure veterans that there is no instance where AI, for example, is being used to make decisions about individual cases. They are tools to support administrative activities. Pierre, as-tu quelque chose à ajouter?
Pierre, do you have something to add? No? No, that's fine. Great. With my 10 seconds, I'd like to thank you for having answered my questions. Great. Mrs. Gaudreau, 6 minutes. Thank you, Madam Chair. I'm going to continue in French. Do you have statistics? Do you have data to indicate that the veteran has been able to use the language of his or her choice? Do you have stats on that? To say you provide French language services is one thing, but do you have statistics to back it up? Thank you for the question. Especially in bilingual regions, this is a required element for work, to be able to speak in both official languages, whether it be English or French. And so with regards to statistics for French language services, as Stephen was mentioning, throughout Canada, we have the capacity to work in both official languages. But I'm talking about statistics because myself, I'm stuck in this. And when I hear veterans tell us, well, listen, I want to speak French, but it's easier for me because I feel a lot of emotions, but
Since 2019, because out of record, a lot of people speak English. So please, faites-moi pas croire, j'ai besoin.
So don't pretend. I need statistics because in French, we speak differently, we feel our emotions, and we're talking here about people who have gone through trauma, and I need statistics because seriously, I have a certain amount of doubt, because even in my language, I lose some time because people don't understand. Sometimes you're very good in French, but sometimes we don't even, my question might not be understood, or people are not listening to the interpreters. So now I think about the veterans who need a medical treatment and they need service in their language, even if they're bilingual. Thank you. Thank you for the question. I'd also like to note, Madam Chair, I really understand what you're saying. Bilingualism is a value of the public service of Canada, and I also understand that Francophone veterans should have the ability to explain their situation in French. And so, if it's acceptable, we can provide statistics with regards to our staff. I still have time left. Now, with regard to hospitals, because they all have their skills and it's exceptional when you talk about medical care, health care, but for our veterans, there's a huge gap between understanding the issue and then asking for what one needs to obtain treatment. And many have told us it wasn't complicated in the past because the hospital understood our situation, what we were going through, and now it's different. And honestly, this was unanimous for all the witnesses. So could we have a specific service for us, for veterans? And could something be created? Because we cannot do anything for provincial jurisdiction, and we don't have enough funding. Well, so what can we tell them? We're going to abandon you when it's over and fix your problem in your province? Or no, we're going to invest, a true investment, real funding, build capital with resources in order to so that they can continue their life journey.
Madam Chair, what I would say is we certainly understand and do not want to have veterans placed in an environment where they're feeling abandoned as they consider their options as they transition, to, whether it's a provincial jurisdiction or a federal jurisdiction. Peut-être je vais tourner vers mon collègue.
I'll turn towards my colleague Stephen so that he can explain a little bit further. Yes, we have clinics that are based in each province, and these clinics provide specific services to veterans. So these are DSO clinics, and the treatments might include issues linked to injuries and traumatic injuries and others. So we do have investments in the provinces to make sure that veterans can consult directly, can obtain in-person service. Also, I can share the huge problem of having, for example, a huge hospital in Montreal that might be difficult for people to have access if they live in a rural region and they might not want to leave, for example, Saguenay to obtain service. They want to stay close to home. And so we also have former hospitals, former veterans hospitals that have been transformed into centers of excellence for long-term care in order to support military staff and veterans. And so we have different sites in Canada that offer direct access, and veterans can obtain necessary care. And the problem is that we cannot have a huge network. So to end, I'd like to see the list of clinics. A lot of people are calling us and we'll refer them to these clinics. Thank you very much, Mrs. Gaudreau.
Thank you so much, Chair. So, Mr. Harris, hello. graph, or in the supplementary estimates B, 25-26, 10.5 million is allocated to, in quotes, funding for the federal health claims processing services contract. When I see processing services contract, is that referring to PCVRS, LifeMark, Loblaws getting additional funding in addition to the $500 million over 5 years to run that program? Or is it actual funding going to assist veterans through the providers that give them the care? Just which of the two is that, please?
It's in fact neither. It is in fact a separate contract that we have with Medavie Blue Cross, who does health claims processing services for veterans. In other words, like a healthcare plan, they do processing of claims that veterans will have when they go and see providers, treatment, or for their medications, for example.
So this is more money for that particular contract?
It is more money for that contract,
Okay.
Based on a transition that's coming through from a current contract to a future contract.
Okay, great. Thank you. That clarifies it for me. Budget 2025 provides additional expenditures of $184.9 million over 4 years, so that's roughly $46 million, to retain staff who were temporary, brought in to help reduce backlogs, and now are brought on as full-time staff. How many full-time staff will be hired, and are they all from that original group that have had at least some training as temporary help? Mr. Will they answer to that one as well?
I'm happy to do so.
Thank you.
Would be approximately 300 staff that would be the subject of that. It's a variety of staff who work in different areas in the department. So fundamentally, it is focused on people who make decisions around disability benefits.
Can I ask?
It would include.
Oh,
yes,
I'm
go
sorry.
ahead.
Okay, so various staff. Where do caseworkers fit into this scenario? Because I don't think they're the ones that process disability claims. Are they? Are they the ones that do that?
No, they're not. So
No.
This is a separate form of staff that do disability benefits adjudication and claims.
So do they get the information from those caseworkers?
The actual applications come into the department from a veteran directly, and they would go directly to a disability benefits team that will review the application claim. So if somebody has a claim for a knee that was injured during their service, they can submit a claim to receive disability benefits.
Our veterans always
People
talk
that-
about their caseworkers, how wonderful they are or how difficult they are. They give that feedback. I'm not really understanding the hierarchy of how this all works and what is the purpose of caseworkers versus the bureaucrats that do the processing of the disability claims. Mr. Harris.
I'm happy to take a moment to explain it. And so case managers work directly with veterans on a range of issues that they may be facing, whether they need assistance with a variety of programs, rehabilitation, whether that's access to a treatment center, something else. The disability adjudication folks are the ones that you would commonly refer to as and note as related to what was frequently called the backlog. The backlog of applications that come in that are first applications that veterans may make to Veterans Affairs to access either compensation or treatment.
I appreciate that. Thank you.
Injury.
So what was the rationale in the midst of a huge backlog to go and completely change the process of service providers through this organization of PCVRS? What was the rationale behind making that significant change to the way that veterans communicate, no longer with VAC, but with a different third-party group? What was the rationale for doing that? Again, Mr. Harris, please.
And Madam Chair, I'm trying to explain, those are in fact two different things. Rehabilitation program is quite separate from disability benefits. So the rehabilitation program is in fact the one that is related to PCVRS, to which the member is referring.
No backlog there.
There's no backlog there, no.
Fine, okay. Thank you. 10 seconds. Well, I want to thank Mr. Harris for being so patient, and I know that he would love to spend a great deal more time trying to explain how complicated and convoluted this sounds when it comes from me. Thank you very much.
Ms. Wagenthal, thank you very much. We're now at Mrs. Hurdle for 5 minutes.
Thank you, Madam Chair, and good afternoon again, folks. I'd like to come back to the accounting aspect of the $4.2 billion and where that's coming from and how that is accounted for. I do believe that accrual-based accounting was used in budgets between 2009 and 2015, but perhaps my colleagues across the way weren't familiar with it at the time. I have a background in business, so I'm quite accustomed to a balance sheet and this kind of accounting. But perhaps, Mr. Tessier, you could take a bit of time to explain what accrual-based accounting is and why that's important around the savings that we're going to be able to see through the cannabis pricing.
Perfect. Thank you through the chair. Accrual accounting is about long-term fiscal planning for the government. That's the basis. Our programs at Veterans Affairs Canada are quadristature in nature and reflect veteran entitlements for compensation, health, and financial supports when they need them. So that's extremely important as the basis of principle. And accrual accounting around our programs represents a lifetime cost that the Department of Finance must plan for today to ensure that there's sufficient funding for when a veteran will require these benefits. Each program is forecasted in terms of costs for those programs and in terms of number of veterans that would apply for them over the long term. And the savings specifically in the budget reflect the reduced obligation that government needs to plan for over the long term, which can now be reinvested. And so that difference of $8 or so per gram to $6 represents the savings.
Clear as a bell. Thank you. That was great. So our government is making historic investments in CAF, which will eventually result in more veterans over the years to come. Can you tell us how this budget will make sure that capacity will be created to serve more Canadian veterans in the future? Anybody?
Merci pour la question, Madame.
Thank you for the question, Madam Chair. Certainly, investment in the Canadian Armed Forces will be considered in our objectives.
Departmental level. The increase in salary, of course, will be reflected in future benefits, but we're also planning as well for what that increased level in the future of Canada's future veterans would look like, and how do we adapt and adjust our service delivery models to make sure that the care that veterans depend on will be there in the future as well. Perhaps I'll turn to Stephen, perhaps if you want to talk a little bit further about that and how we are preparing for those investments and those eventual veterans.
Thank you, Deputy. And we're working closely with our Canadian Armed Forces counterparts on their recruitment and their retention, and ultimately preparing for what would be an increase in veterans who may need to come to us for benefits and services as well. And so, as has been noted a few times over the course of this meeting, we are trying to put in place better processes to help support all of the veterans who might need our assistance, including through transition, through an application process, through internal processes that helps to speed up both decision-making and access to benefits and treatments. And so we're continuing to work with our CAF colleagues to ensure that they have the support that they need to make sure that growth in their area is something that we are going to be able to support as well.
Thank you. I'll pivot slightly for my last question. At an event last month celebrating women veterans, we heard, members of this committee in attendance heard about the need to tailor benefits for women. So are there aspects of services which can be tailored to women veterans in advance of this budget, or as part of this budget?
Merci pour la question, Madame le Président.
Thank you for the question, Madam Chair.
engaging with our women veterans right across this country, including members of the Women Veterans Council, but looking at engaging women more broadly to ensure that their lived experiences are reflected in the services and benefits that we offer. Those perspectives are very, very valuable, and we have specifically undertaken a GBA Plus analysis of our programs and benefits. We've updated our table of disabilities and our EEGs to reflect their experiences.
Pour 2.5 minutes, Madame Gaudreau.
Mrs. Gaudreau, 2.5 minutes. Thank you, Madam Chair. My question is for Mr. Harris. So you saw that I'd like to know where are these clinics, coast to coast to coast? You've taken note of this? Yes, no problem. We can share that information. Great. My other question, it would be great to have numbers on the Wellness Fund for veterans and their families, and to see what's happening in Quebec and elsewhere. What I understand is that we don't have any data. Well, I'm asking, do you have data on a veteran who has French as a first language or no? Do you have this information or not? Stephen? Do we have the first language of veterans information? We have a lot of data, actually, with regards to official languages and first language for veterans with regards to the Wellness Fund. My colleague Mitch Freeman, who is with you, will be able to provide an answer with regards to Francophone participants. Thank you, Madam Chair. Thank you for the question. I don't have the data right here with me, but I'll be pleased to share this information with the clerk. Thank you. And I'd like to know what is the percentage also, the percentage of the budget for the Wellness Fund for veterans and their families in Quebec. I'd like to have that figure. And that way we'll have many numbers and we'll be able to do an analysis. Last question. How is it possible that we're still dealing with subcontractors who don't necessarily have the expertise required? And there are some organizations, such as the Sentier, and they say, well, yes, a little funding is one thing, but also medical resources are necessary. So why are we not dealing more with these types of organizations? Thank you for the question. Stephen, are you able to answer? We work with many different organizations that support veterans, not only with regards to the Wellness Fund, but also direct services to support the special and different needs that exist for our clients who are veterans, but also expertise is required. I'm not saying that the organizations do not have any expertise. We do need people with medical expertise, specializations. It's ideal if they have the medical. Thank you. I'm sorry, Mr. Harris. Time is up. I have to interrupt you. Sorry about that.
Thank you very much, Chair. Mr. Harris. Graph 1 of Departmental Plan 25-26 indicates the department's total budget will decrease this next year by $2.2 billion. Can you just very briefly give me a couple sentences? Is that due to Pension Act war veterans passing on and the need for those dollars to no longer exist in that way?
Madam Chair, I might just ask my CFO colleague to take that question.
Yeah. Perfect. There are two key factors that demonstrate that you see the decrease to $5.6 billion. The first one was that we had temporary funding that was planned to end in March. The second one was no ongoing update to our quasi-stat previously and the way our funding is booked. And so there are these two items have been addressed. So specifically, the ongoing funding, the $184.9 million over 4 years, that's one part of it, and the $40 million ongoing. That will enable us to process more disability claims as they come in. And this,
That's a good answer. Very briefly, in 2021, a recommendation was accepted by the government that would provide mental health care funding for family members in their own right. So it was agreed to. I understand VAT can't do anything about that without a legislative change. Has any work been done to determine the costs involved in something like that, and what any recommendations made to the government in coming to a decision on what they agreed to bring into change with legislation? And I don't know who should answer that. Thank you.
Thanks, Madam Chair, for the question. A couple of things I would say. Certainly, there's been lots of work on making sure that families have mental health care to the best of our ability inside of the current legislative framework, as you've highlighted. And certainly, a consideration on how to evolve that into the future is work underway. No direction at the moment, and that would ultimately be a change of that legislative framework.
So would it have to come from the government wanting to have the legislation to kick off that process of determining how that would fit into the overall budget of VAC?
Certainly, it would have to be a conversation around a legislative change. That would be a decision of Parliament.
And nothing on that has been done to date?
Well, I would say that I've not seen anything tabled in Parliament for that type of decision.
Exactly. Okay, thank you. I was good. Sorry, I'll pass it on to
You still have time, so
yes.
Yeah,
2 minutes.
I think she
Sorry.
intended to turn it to me, and I was aware that she was, but I didn't realize that was the moment. So you got to be ready when your moment comes, right? I've got a question, and whoever's most appropriate to answer it, Ms. McDowell. With regards to both the veterans employment strategy and the homelessness strategy, can you tell me what the cost to date of each of those two programs has been, and then also what are the metrics to determine success for those two strategies?
Thanks so much for the question, Madam Chair. Certainly with both of those programs, they are very, very important, very critical for veterans. In terms of homelessness, no veteran should be homeless in this country, and we take that very seriously and are working with our partners at Housing and Infrastructure Canada to implement the Veteran Homeless Program.
I don't mean to interrupt. I mean, I agree with you. We both are agreed on the importance of the strategies. But I have a very limited amount of time that I'm provided. You know, the chair will cut me off if I use it. So I just need to know what the cost to date for the two programs is, and what are the metrics for the success. Because I've got one follow-up question as well.
Okay, that's great. Thank you. Thank you for the question. For those specifics, I think I'll turn to Mitch Freeman, who can talk about the cost and the metrics.
Thanks so much, Madam Chair, for the question.
Perhaps while you answer, just in case there isn't enough time, could you tell me exactly, or at least give me some kind of an idea of how many veterans have found jobs through the employment strategy, and how many veterans have found housing through the homelessness strategy?
I will speak quickly, and I can only speak to the homeless. My colleague Stephen Harris could speak to the employment numbers. But what I can say through Madam Chair is that the homelessness program is approximately $79.1 million over the life course of that particular project. It has, since its inception through to March 2025, has assisted over 1,400 veterans and has helped find secure housing for 233.
Can we let the...
Harris, I'm going to ask you just to answer. You have a few seconds left, but please answer.
Very quickly, Madam Chair, I would say the cost of the National Veterans Employment Strategy is internal costs, so FTE costs, employee costs in terms of developing the strategy, consultations, things of that nature. It's about 7 or 8 FTEs that are involved in developing the strategy. And in terms of the output from it, there's lots of employer engagement. There's lots of help with veterans to find jobs who work through our career transition services, 2,100 a year. Engagement that we've had with 7,000 participants through webinars that help to find employment and direct interviews with individuals.
Sorry, and can he just give us an idea if we know how many have actually gotten jobs? We just didn't get the answer, that was all, right?
Thank you very much, Mr. Harris. I really appreciate. Want to know, I apologize again, Mr. Casey for 5 minutes.
Thank you, Madam Chair. Deputy McDowell, the new money in the budget was $184.9 million with 40.1 ongoing. Can you or someone on your team provide a breakdown of those funds?
Absolutely. Thank you for the question. Madam Chair, perhaps I'll turn to Stephen to talk about how the $184.9 million will be used in terms of stabilization of our service delivery network.
Thanks, Madam Chair. So the breakdown of the $184 million would be $40 million on an annual basis will be in place for employment, essentially stabilizing on a permanent basis staff who work directly in disability benefit adjudication and related areas. And so that's $40 million on an annual basis and ongoing. The rest of the money above the $160 million that would account for is related to service modernization. We've had a couple of answers earlier in this session that talk a little bit about what service modernization is. Improvements to internal IT systems, improvements to processes and other things that will help us serve veterans in a much better way by offering more rapid service, more efficient service, and providing them with the ability to get the services as quickly as possible as well. So that is innovation from an automation point of view, helping to make things move automatically in the department to allow for faster decision-making and easier access to benefits and services for veterans. These things will be implemented over the course of the next 2 fiscal years. So that starts at April 1st next year, pending overall approval and review. And that will immediately help to assist veterans in accessing services in a simpler way.
All right, my next question is about how you measure client satisfaction. So we have had a steady parade of witnesses come before the committee invited by the Conservatives who have told us some pretty horrific things about their treatment and the impact of the treatment that they perceive, that they have or perceive to have had from Veterans Affairs. So my question to you is whether this is a representative sample of the clients you serve, and to put more detail on it, or to put more to provide us with how you measure the satisfaction of the people who call in to receive services, and what those what's the information that comes out of those measurement mechanisms.
Thanks for the question. Feedback from veterans is absolutely crucial to what we do. It's crucial to any service department, taking that feedback on board, whether it's anecdotal, but we also carry out a number of systematic ways of collecting that feedback, including a national veteran survey that is carried out. We seek feedback, as I mentioned, from advisory groups as well, and we also carry out, as I mentioned, surveys. We engage directly with underrepresented groups and take their feedback on board, and that feedback is collected and then actually shapes the way that we deliver services and the way that we provide the benefits that we offer. Maybe I'll turn toward Mitch. Perhaps you can talk about some of the national client surveys that we carry out.
Certainly, thanks so much for the question, and certainly offer to my colleague to add any particular items. But there is a national client survey that's completed every 2 years that goes out to a subset of Veterans Affairs clients that are statistically relevant to create the sample group. And that most recently, I don't have the exact number. I suspect ADM Harris does with respect to overall satisfaction. But the process is such that a statistically relevant sample is out, and veterans respond to that survey every 2 years.
Were there any district offices closed in this budget?
there were not.
Okay. Thank you.
Thank you very much, Mr. Casey. On this note, I will complete our time, and I would like to say thank you very much to our witness. So I will ask to suspend very briefly so we can say proper goodbye to all of you, and certainly on our behalf, we would like to say thanks, Merry Christmas, Happy Holiday, and the very best, Happy New Year to all of you. of this committee to entertain. So thank you very much for all of you. So I do have a questions to ask to this committee. Does the committee wish to vote on the supplementary estimate now? See? So there are 2 votes in the supplementary estimate B for the 25-26. Unless any objects, I will seek the unanimous consent of the committee to group the votes together for a decision. So is there unanimous consent to proceed this way? Excellent. On division. Shall I report the... my goodness, it's getting late. I apologize, guys. Shall I report the vote back to the House? Oh, sorry. Yes, I have to say I'm... thank you. Good point. Shall all votes refer to the committee in the supplementary estimate B 2025-2026 carry? Perfect. Shall I report the votes back to the House? Thank you very much. Okay. So before I seek a motion to adjourn, I would like to ask if the committee is willing to adopt. Yeah, so there was, I think, because of last meetings, we did not adopt the budget for the study on the supplementary estimate B that actually just took place. The budget was shared with all of you by the clerk on Thursday, November 27, 2025. It was a small amount, but I do have to have this adopted. So is it the will of the committee to adopt the budget? Merci. Thank you. Pardon me?
Interesting as it would be, right, to find out if we don't at this point.
Well, okay. Those are very important procedural aspects of my role. Notre prochaine réunion aura lieu le jeudi.
Our next meeting will be held on Thursday, the 4th of December. We will resume our study on suicide prevention among veterans. We will hear from witnesses for the first hour, and the second hour will be in camera to give our analyst instructions for drafting the report. Does the committee wish to adjourn this meeting?